with the implementation of the Veterinary Feed Directive, it's exposed a lot of practices, a lot of weaknesses, a lot of things that we faced in our labeling of products that we didn't really pay attention to in the past. Some practices are actually were never approved, but just commonplace. So with that, we have a panel today to talk about our minor species representing aquaculture, bees, and small ruminants. We'll have them introduce themselves and give a short introduction. They'll have a short presentation. They'll all three go, and then we'll have them open for a panel discussion afterwards. So our first presenter, Dr. Gaunt. Gaunt, okay.
So, yeah, I've been asked to kind of give a 7 to 10 minute talk on VFD integrations in the aquatic species. And this is kind of getting pared down from what was a 40-minute presentation that I've been giving to producers and to other veterinarians. So I've kind of picked slides that I thought were kind of the highlights of the talk, and I'll kind of focus in on those. I am from the Mississippi Delta in Stoneville, Mississippi, and we're right in the heart of the catfish country. I work for Mississippi State University College of Veterinary Medicine, and we are about 110 miles west of the main campus in Starkville, Mississippi. And we're there because the catfish farmers want us there. We've got 3 faculty members, and so what we do, we run a diagnostic lab for the farmers when they have sick fish, and we do research, and we also teach. So those are our three drugs that we have for use as medicated feeds. And these are essentially all of our antibiotics in aquaculture, because practically when you're talking about feeding antibiotics to a pond of catfish, which can hold up to 100,000 fish, it's got to be by medicated feed, okay? You can't take these guys out and hand inject them. You can't take them out and immerse them on a practical basis. So that's how we are medicating our fish. Okay, Aqua Flora was approved as the first aquaculture VFD drug. And this was done back in October 2005. So we've actually been using VFD drugs in aquaculture in the United States for over 10 years now. So I'm proud to tell you the first label claim for Aqua Flora was for catfish, for ESC. And since then, the label claim has been expanded a whole lot to include a lot of other bacteria and a lot of other fish species. Okay, so on this new VFD rule, we've got to talk a little bit about the veterinary client-patient relationship. Okay, this has changed a little bit since the first VFD rule. As we heard a little bit earlier, the veterinary client-patient relationship can either be federally or state-driven. In Mississippi, we're under the state VCPR. In the other states where I practice, it's all federal. And so if the state does not have the minimal federal requirements under its state VCPR, the federal requirement's going to kick in. So the veterinarian has to have the knowledge of the fish health either by inspecting the fish directly or going to the farm. And he has to assume responsibility for the clinical judgment of the fish health and be available for follow-up care. Provide oversight for the proper use of medication with prompt treatment and the proper regimen, and maintain records. One of the biggest complaints that I get from producers is that there aren't enough veterinarians who are comfortable in practicing aquaculture medicine. And so one thing that we've done at Mississippi State that I'm really proud of is that we make it mandatory for our veterinary students in Starkville to come over to the Mississippi Delta for one day. And they get to visit farms and look at hatcheries or go through the ponds, watch the fish getting seined, ask farm managers questions, and then they come to our lab And we do a couple of hours of teaching them diseases, discussing diseases and causes and treatments. And then we take them to the lab where they actually do hands-on on clinical cases that we've seen of columnaris disease or enteric septicemia of catfish. And we allow them to work on live fish and bleed them and dissect them and just learn a little bit more about the fish industry and fish health. So once in a while we'll actually recruit one of our students, and they'll come back and spend a week or 4 weeks with us as part of their rotation. And we've actually taken students from throughout the United States and from Europe as well. They come over and spent time with us to learn more about fish medicine. So this is a nice program that kind of introduces veterinary students into aquatic animal health, which I think is really, really important, whether or not they want to make this their sole career or if they want to kind of branch out if they're doing private practice with dogs and cats or large animals. One of the things that you'll notice from this slide is that all of these fish are dead. In the aquaculture industry, for people who aren't real familiar with it, you never see your patients unless they're up feeding, which is a good thing, or unless you're seining them and sending them to the processing plant and you've been real successful in raising them, or unless they're very sick. They'll be bobbing up at the top. Usually they're down in the water column. So these guys weren't doing especially well, and they wound up in our diagnostic lab. And unlike in cattle medicine or horse medicine or dog and cat medicine, it's a one-way trip for our patients. They don't get to leave. I talked to Dr. Wong, who's a state veterinarian over in Hawaii, and she told me this morning that she actually has a Mississippi State graduate over there working for her in aquaculture. So I'm very, very proud of that, too. I had to mention that. Okay, so under these BCPR, we're going to also have to issue this VFD order in writing with all the required information. I've been told that most everyone in here is very familiar with the required information on that, so I'm not going to go over it. And you have to maintain either an electronic or an original copy of the order for FDA inspection for 2 years. And that's the federal requirement. Some states require a record retention for more than 2 years. So veterinarians have to check with their state licensing requirements, and if they want you keeping those records for 3 years, the VFD orders have to be kept for that length of time too. And the veterinarian also has to provide either an electronic or a hard copy to the producer and the distributor. An electronic copy, by definition, is a secure copy that meets federal regulations. I see Global Vet Link is one of our sponsors, and they provide a service as well as DVM RX Express. So please understand that by PDFing a hard copy, that is not an electronic copy. Okay, so if you PDF a copy to the distributor or to the producer, you do have to keep that original VFD order on file. Okay, as the producer's responsibilities, he's got to cooperate with the veterinarian to maintain a valid veterinary client-patient relationship. And that means following the dose rate, the duration of use, expiration date, and withdrawal time. Okay, I gave a talk a few weeks ago to a group of producers, and they looked pretty shocked about this, that they had to use this for the full duration of use. So if the label claim says 10 days, it's got to be used for 10 days, and they want to shortcut this to save money, to go into to just treat for 5 days. They also have to maintain the electronic or hard copies for 2 years, and they can present the copy to the distributor if they're going over there to get the feed anyway. Okay, so this new VFD rule went into effect for Aqua Flora in 2015, And everybody knows it went in for previously over-the-counter drugs in January of 2017. And an expiration date can be extended up to 6 months by the veterinarian. That's kind of his or her choice on whether they think that's important. For us in the catfish industry, we've got the infrastructure there, so it's not really an advantage for us. It's an advantage for groups. I know in the Midwest there are some hatcheries where they can't get a lot of medicated feed, and there aren't veterinarians who are readily available to write these orders. So that will come in handy for those groups of hatcheries people. The order forms are going to require production class and the approximate number of fish rather than the biomass like we used to write. Okay? The production class would be, as an example, fingerling catfish or food fish catfish, and then the producer and the distributor can calculate the feed quantity from there. And as we heard earlier, extra label use of VFD drugs is not approved. Okay? It's still illegal to do it, technically, but FDA is using enforcement discretion. So the veterinarians, the producers, and the distributors are not going to be penalized as long as they're following certain rules and guidelines on this. The expiration date, as I mentioned, was less than or 6 months from the date of issuance, and that's now in effect for all the VFD medicated feeds. The duration of use, I just want to point out, it's not new, but it does have to be followed. It's part of the approval for this medicated feed. Okay? And as an example, Aqua Flora is 1 time a day for 10 days. That full duration does have to be followed. And if the VFD order is written for an extended amount of time and it expires before the producer finishes that duration of use, they have to get a new VFD order. And in aquaculture, we don't have any refills allowed here at all. Interesting. Okay, so yeah, here's an example here of VFD orders and expiration dates. This kind of makes that a little bit clear. So if a producer comes in and they bring you some fish on May 1st, and he says his pond is stocked with catfish fingerlings, and they've got ESC, okay? So there's pond 1. And then he mentions that pond 2, 3, 4, and 5 are adjacent to pond 1, and he expects these ponds to break with ESC, okay? And what he wants is his VFD drug, he wants Aqua Flora, to treat ESC in pond 1, but he also wants this VFD order for ponds 2 through 5, because he knows they're going to break. They do this every year. The birds come in, they land on pond 1, and they fly to 2, 3, 4, and 5, drop sick fish into these ponds. So he wants you to write a VFD order with a 10-week expiration date to cover these fish. Okay, so pond 1 gets treated May 1st through 10, and sure enough, on May 20th through 29th, pond 2 breaks, and you can see so on down the line. Okay, so if pond 1 was treated and the last day of treatment was May 10th, and then a week later it breaks again with ESC, you cannot take the feed from pond 5 and start treating pond 1 again, okay? The veterinarian has to write a new VFD order for this, okay? This pond can only see 1 batch of feed per VFD order, okay? So you finish up July 4th. If pond 5 had broken longer and say it broke on July 19th and you needed a 10-day duration, you'd have to get a new VFD order to finish that out because you're out of your 10-week time frame there. Okay, and again, this has to appear on the label that extra label use is strictly prohibited, and it's required on the VFD order drug form. So their FDA is using enforcement discretion. You still have to have a valid VCPR in place, follow the duration of use, withdrawal times, a proper regimen, and the maintenance of records. And this is the VFD form. I downloaded this from the AVMA website. All the sponsors have a form, and there is one on FDA's website as well. But what you do have to put up in here, if you're using this in an extra label fashion under that special instructions box, you have to say that this VFD was issued in accordance with CPG 615.115. And you have to list the species and the indication for which it's being issued if it's different for any of the label claims, okay? If you're treating Nile tilapia for strep A galactea, there is not a label claim for that, and that has to be listed under this special instructions box. And also if any withdrawal time is different. You can't shorten the withdrawal times, but if you're prolonging it, you do want to list that as well. And extra label use is only for contained traceable fish, okay? If you're out fishing in a lake or a river and you come up and you pull up some bass that have some strep on them, don't expect the veterinarian to be writing a VFD for that, okay? These are pond fish, tank fish, net pen fish. Okay, and that's all I've got for you there. All right.
Mark, do you want?
You can go ahead and introduce yourself.
Sure. Well, my name is Mark Dykes. I'm the Chief of Apiary Inspection for the state of Texas. I'm also the President of the Apiary Inspectors of America. My background is in ecology and agricultural inspection. I've been doing bee inspection for a while now. And so we're a little bit different, it seems, than a lot of the other producers in the room. I mean, I think we're the only insect people at this entire conference. Am I right about that? So, but in addition to that, we're talking about bees. And so this is a very new thing for us. This came out, obviously, January 1. We've been scrambling very hard to provide education to both beekeepers and veterinarians. And so my presentation is going to be a little bit different than the ones previous. I just want to kind of give you a background of bees and beekeeping, and then talk about the diseases and then the legal issues in addition to the prescribing of the antibiotics that we run into with the diseases that are treated with the antibiotics. And so this is one of the issues that we're kind of facing right now, and I'll be honest, we're definitely behind the 8 ball on it, and we're playing catch up. So hopefully we can get ahead of the ball here real soon. Just to break it down, though, in beekeeping we have 3 distinct classes. We have commercial beekeepers, which are the large beekeepers that keep, we generally say 250 hives. That's a very, very small operation. The largest operation in America has about 90,000 hives. So it varies a lot. Average for a commercial entity is around 3,000 to 10,000 hives. And so it's quite a number of hives. These numbers vary greatly throughout the year. In the spring, they do splits, which is increases of the hives. And so their numbers can jump very high. But as we've all heard through the media, and let me tell you, the beepocalypse, that's not a real thing, even though they reported on it in Time Magazine and everything like that. But we do experience losses up to about 30 to 40% over winter, sometimes up to 50% annually. How many other industries have that issue? Not many. Thankfully, it's not a result of antibiotic use, it's other pests and diseases, but antibiotics do play a role in keeping the bees healthy. This bottom group right here, the hobbyists, and I heard this mentioned in a previous talk, are the ones that have a lot of misunderstandings about drug use. They're keeping these bees as pets, not livestock, which is in essence what commercial beekeepers keep. But I'll tell you, they're the most vocal group. And so that's the issue we're running into as regulators and as educators, is making them understand, well, yes, I understand you want to keep these natural chemical-free bees, but the reality of the situation is, to make it commercially viable enterprise, we have to use some chemicals and some methods of treatment. And so that's been a huge issue. And if anybody knows the answer to it, let me know, because we definitely could use some help on that. Commercial operations, most of them are migratory. You'll hear about almond production. So if you think about it this way, each year, 2.5 million beehives end up in California. Bees fly an average of about 3 to 5 mile radius around their hive where they can. And if you kind of think about that in geographic aspects, these bees are crossing paths at some point, or at least overlapping territories on a very large scale. So majority of the commercial beehives in America are exposed to each other each year. So imagine putting all the cattle in America in one giant feedlot. You know, you have the chance to spread a lot of really nasty stuff. And so that's always been a big issue. A majority of the states came up with apiary inspection services in the early 1900s to combat what's called American foul brood, which we'll talk about more in a minute. It used to be a very bad disease that would run through the beehives. We've since limited the amount that we see out there. We've really reduced it between the use of antibiotics and very aggressive inspections. And so we've helped with that, but there's still the chance for these types of things to flare up again in the future. And so that's been a big issue. Just real quick, a couple of the terms, and I'm sure you've heard thrown around there quite a bit, that are often very much confused, is colonies, hives, what we call nucleuses or nooks or nukes, depending on which part of the Mason-Dixon line you cross, and then apiary. Colony is just simply a congregation of bees kind of living as a superorganism. When we talk about bees, generally speaking, we're talking about a colony, not just a bee. Because a single worker bee can live for about 21 days. A colony can live for years. And so that's where the big differentiation comes. Hives are where we keep them. Nukes are just small hives. These are generally what are sold from beekeeper to beekeeper to increase their numbers. And then finally, apiary is just where they're kept. I can't tell you how many people think I work with birds, because they hear apiary and think aviary. So it can be a lot of fun sometimes. The hives are all pretty much the same. You'll see different colors. You'll see a little bit different as far as tops and bottoms, but the hives themselves are very universal. So once you understand what's in the hive, it's easy to work with. This is one issue that we found, pardon me, teaching veterinarians about beehives is, and we had a little talk about this earlier, is in America we don't expose vets to bees unless they want to learn about them extracurricularly. In Germany and England, over in Europe, they actually do learn about bees. And so we're a little bit behind the times when it comes to this. So what we do as inspectors and as educators is we're trying to train veterinarians to go in there. How many of you guys like getting stung? Couple? Yeah, there's a few out there. It's actually not that bad after a while. But convincing somebody, you know, I've seen a vet that will go into a ring with a 2,000-pound bull without blinking an eye, but if a bee comes around, they're running to their truck. So it's kind of an interesting thing, and I don't blame them sometimes, although I wouldn't want to be in the ring with the bull. But the education and the understanding of bees is not easy for us to convey to the prescribers, and so that's been a big issue in the past. Something a lot of people don't know is that bees are not native to North America. These are an introduced species. The Indians call them the white man's fly, because we brought them over when we started settling the United States. They've very much made themselves at home. We also have the Africanized bee. You don't have it up in Ohio here, but in Texas, where I'm from, and I used to work in Florida, we have it there. And so, you know, you hear it called killer bee. I'll let you in a little secret. Any bee can kill you if you're allergic. Africanized bees just have a higher defensive response rate than the European bee. And so that's one of the things that we definitely have to teach people about. We have 3 castes of bees, workers and queens. Workers and queens are actually the same bee. The queen was just fed a different diet as she matured, so she developed sexually, whereas the workers did not develop as mature as sexually. And then drones are simply for mating. They don't actually contribute anything to the hive. So the workers, the females, are the only one that contribute to the hive. They're also the only ones that sting you. And so that is where that unpleasant part about working with bees comes from, is the workers and the defensiveness of the hive. Then obviously we have the brood and the frames. So everything bees need to survive is on these frames. This is also where all the diseases are. And so, as you can see by this list, bees have a lot of issues right now. You add to that poor nutrition, pesticide exposure, and breeding quality. It can be a big issue. We do have two types of what we call foul brood. They are bacterial infections of the beehive, and specifically of the larva and pupa. European foul brood is a non-spore forming bacteria. It's relatively benign. It can be found in hives, but generally will clear up on its own, or as the nutrition input into the hive increases, this generally goes away. The bees can take care of themselves. The biggest issue we have is American foul brood, which is a spore-forming bacteria. Some of these spores have been found to live for up to 80 years. So once it gets into a colony and into equipment, it stays. This is what my industry was set up to do, is to inspect for American foul brood. Generally, we're only seeing 1 to 5% infection rates anymore with this, not very high. In Texas, we actually don't see it very much, partially because of the producers. The minute they find it, they get rid of it. So by the time we're around inspecting, we never see this. But this is the main disease that antibiotics are used to treat, because they can be effective at suppressing this. Once the symptoms become very acute, the hive's pretty much done for at that point. Even the antibiotics can keep it going, but it won't recover from it. This is what it looks like. It's the hive. The brood actually turns into a goo, and we have this what we call the snot test, where you put a toothpick in there, you stir it up, and pull it out, and it ropes out very far. It's kind of a interesting thing. This is what the brood looks like under cappings. As the brood pupates, it's covered and it pupates under the capping. The cappings will be perforated and will be destroyed or opened up by the worker bees, because they know there's an issue, but the worker bees will not clean it out. And so as a veterinarian, this is what you would see in the hive going into that. We do have 3 antibiotics that are labeled right now for use: Tylen, terramycin, and lincomycin. Historically, they were used as a preventative treatment. Beekeepers would use these on a bi-yearly basis when it was an over-the-counter medicine to treat their hives, whether they had foul brood or not. And so this is an issue that we think may cause a resurgence in foul brood, is that if they stop doing this, and there was historically foul brood in their hives, that this may present very heavily again. And so this is the issue that we're having at this point is, as you know, with the way the VFDs are written, is it may not necessarily warrant treatment if it's not found in the hives. And so this is where beekeepers are having a lot of trouble. Historically, beekeepers have never had relationships with vets, and so this is something that we're slowly developing and helping develop. One of the big confounding issues with this, though, is in a lot of states, American foul brood is a reportable disease, and in a majority of those states, when it is discovered in colonies, the colonies have to be destroyed by either bagging them up, radiating them, or burning them. That's the only way to get to that the state will allow for the destruction of the hives. And so this creates the problem then of, if the vets are discovering it, then they have to report it, or at least the beekeeper does. But if the vet, depending on how the law is, I know in my state in Texas, if the vet is the one to discover it, they have to report it to us. And so this is creating a kind of a friction between beekeepers and the state regulators, is that they want to do the right thing by treating their hives to keeping their bees healthy, but if it is found, then it has to be reported and we have to inspect their entire operation. So that's been an issue, and I don't think it's going to go away anytime soon. A couple of resources for you. Apiary Inspectors of America is made up, we currently have about 35 members, member states. We have a website that has all the apiary laws throughout the United States kind of gathered in one place, and we also have links to all the members. So the issue that we're finding is connecting with the people that have the knowledge of beekeeping with the veterinarians, and so this has been a big issue. The extension, Cooperative Extension Service has done a really good job of creating a website on bee health it's starting to have some information on that. There's also a private website that's set up by beekeepers to track vets that deal with honeybees. And this is a relatively new thing, but we're looking at trying to integrate this into the larger honeybee associations. And so those are probably right now your best vets for resources on bees. Also if you have any questions, by all means give me a call. And I know I've run over time a little bit, but I just wanted to give a quick rundown. It has been an issue for us, and I'm really interested to hear what the conversations are from the other industries. So thank you.
I appreciate that, Mark. I had a client call and ask me if I could help them with their bees, and I said sure, but trying to get a halter on them things so you can palpate them. I don't think they want me to be their bee veterinarian. So I was asked to talk a little bit about VFDs in minor species in 5 or 10 minutes, and so I prepared 47 slides. No, I did actually, but no. So I'm going to actually, excuse me here, I'm going to try to bump way ahead because you've heard most of this stuff already, so write this down real fast. Here we go. All right. So let's get to minor species. There we go. So mostly I'm going to talk about sheep and goats and white-tailed deer, but FDA considers anything that isn't cattle, horses, swine, chickens, turkeys, dogs, and cats to be a minor species, and so some examples are some of the things that we've already heard about today, and again I'm going to talk mostly about sheep and goats. And so this slide in here obviously is old, but I left it in here for a reason, because when I started giving talks to producers and vet students and things like that about VFDs last fall, some of them before the first part of December, we didn't have any compliance policy guide for minor species. And so, which is pretty amazing, right, since how long we've known that this is coming. But as of November, we still had nothing in place to allow any extra label use for VFDs in minor species. Of course, that changed as of December 2nd with the release of Compliance Policy Guide 615.115, which now allows for extra label use in minor species, which we've already heard about a little bit. Sort of, right? And Dr. Gaunt already mentioned this, but so the Compliance Policy Guides allows us now to use some products extra labelly in minor species such as sheep and goats and deer, but it's still not legal, right? Which gives you a really warm, fuzzy feeling as a veterinarian issuing a VFD when it's really not legal to do, because as the law is actually written, as I understand it, for VFDs, there's no extra label use period. But there is enforcement discretion being executed. So because of that, basically, as long as we follow all the rules in minor species, we won't get a ticket. So you can drive 85, you're just not going to get pulled over. You might get pulled over, but you're not going to get a ticket, right? So currently, we really only have a couple of products for sheep approved for VFD drugs, and that's CTC or Aramycin, and that is to treat Vibrio abortion in use. So as far as breeding class goes, sheep is the only one, CTC for Vibrio abortion, period, at 80 grams, yeah, that should say milligrams, sorry, 80 milligrams per head per day, and so that doesn't do anything, really. It's not very effective at that dose, but that's what we have a label for. So technically, to stay on label with breeding sheep for Vibrio abortion, we should use that product. We also have neomycin and oxytetracycline combos, or just oxytetracycline by itself, that we use in growing sheep. We can use in growing sheep for E. coli, diarrhea, colibacillosis, and pneumonia caused by Pasteurella pneumonia. And there are no VFD products approved for goats, and the same would be true for white-tailed deer. So we are now, again, sort of allowed to use them in extra label use. We can consider them for treatment if no other treatment options are available, and we determine that the health of the animal is threatened and suffering or death would result from failure to treat the affected animal or affected flock or herd. Okay, so as long as all three of those provisions are met, we can consider things extra label. We all know that extra label use in minor species isn't new. That's been around since early mid-90s, right? But it didn't necessarily transfer over to VFDs. So what do we have to have? This was already mentioned. We have to have a valid VCPR, and we have to limit the extra label use to a minor species that's not on the drug label, or use an indication for a minor species that's not listed on the label. Has to be approved for use in a feed, okay? So it has to be fed, and we're supposed to use it in a minor species that's similar to the species for which the medication is approved. There we go. So this was already mentioned a little bit, but aquaculture extra label use would have to be limited to use in approved aquatic species, avian to avian, and then mammalian to mammalian. So when it comes to sheep and goats and deer, we can use cattle, and for some strange reason we can also use swine VFD products extra labelly in small ruminants. We can't use aquatic drugs at those doses, or avian, etc., in our small ruminants. So we cannot use it for production claim. Okay, so it has to be a therapeutic thing. Those are all gone, and even under CPG 611, we can't use it for any production claim. And the distributors and/or manufacturers of the product are not allowed to advertise something to be used in a minor species. In other words, they're not allowed to say, "Oh, hey, you can get this cattle product for your sheep or for your goats." That has to all be done. That has to all be done through the veterinarian. I'll get it here eventually. One important thing to mention, I think Dr. Gaunt mentioned this too, but whenever we write a VFD extra labelly for small ruminants, we have to also attach a separate written recommendation to the client that basically explains our rationale, what we're going to do from a withdrawal standpoint, things like that. So, for example, if I want to use CTC in goats, and I want to use it at a higher feeding rate than what the sheep one is, then I have to provide a rationale for that as to why it doesn't work at the sheep dose. Or similarly, if I want to use a CTC product that's labeled for cattle, and I want to use it for chlamydia abortion in sheep, or goats for that matter, at a different dose, I can stay on the cattle dosing rate. I still have to follow that cattle label, but I have to explain in my written recommendation why I don't think it would work at the sheep dose, for example. Does that make sense? A little bit confusing, but and then just like VFDs, you have to maintain that record for 2 years. And so that written recommendation gets stapled onto the VFD, gets attached to it, and goes along to the distributor just like the VFD would. In order to do this, we do have to go to the special instructions part on the VFD. We use Global Vet Link in our practice, but there is a special instructions box where we go in there and we have to enter in that the VFD is being used in accordance with Compliance Policy Guide 615, and then we have to list the actual species that we're using it for, and then if there's any change in withdrawal over what the label would already have, we have to list that there as well. Okay, so we can still use things in the water. This is important for a lot of small ruminant producers. They can still use sulfa in the water for coccidia treatment. Obviously, we can still use Bovatec, Rumensin, cord, things like that. That's not regulated, but things like the water medications, things like sulfa, they have to have prescription. Don't have to have a VFD, but have to have prescription. So we're still allowed some extra label use latitude in small ruminants. Just going to be in, in a prescription. So there, that's all I have. I suppose we're going to open it up for questions.
Yeah, that's what I understand. Well, thanks again to all three of our panelists. As you can see, in the previous years in this meeting, we've talked from the regulatory side. They've mentioned, what we're going to have to do to VFD. Now we have our minor species groups here to tell us what they're actually doing. So you get a chance to really to quiz them or ask me questions. Any questions for?
Let me ask a few questions. I'm one of the principal authors of VFD. We did it. I want people to understand why we did it. We did it because the agency told us they were going to go to prescription medicated feed. And that meant we had to have a pharmacist in the feed. That was untenable, and the distribution system was not. It actually happened after the Addendum law, 2 years after. Okay? Dr. Gaunt, it's
Yes,
been a
sir.
while since I've been down.
My pleasure to see you again,
How's
Richard.
VFD working in aquaculture? I guess I could ask Paul.
VFD's working great in aquaculture with Aqua Flora. As I mentioned, we've been there for 10 years, so we're comfortable with it. Our farmers are comfortable with it. We're just now starting with terramycin and Ruminant, and I don't have any feedback with the farmers on that, but I'm optimistic. I think from a veterinary standpoint in the Delta, it's going to be just fine. I'm not sure that the farmers are going to be real happy about having to come see us every time they need an antibiotic. Yeah.
Sorry about that, but that's the way it works. Had I seen, the agency promised us in 1996 that no previously approved drug would ever become retroactively VFD. I learned a valuable lesson, and I have since tied their hand on every piece of legislation I've done, and that is we should have put it in the law. That would not have happened. So we are also the principal objectors to extra label drug use in feed. And principally because it's not like a veterinarian going to a producer giving an injection or giving some pills. It's we are ultimately responsible in the feed industry for what comes out of that mill. We have a lot of angst in the minor species CPG, but we're the ones that proposed it 9 years ago. They adopted exactly what we suggested. And why it took 9 years to happen, I don't know. But they had a lot of pressure in November and December to get this done, especially from the sheep industry, and rightly so. Okay? So these are minor species. They're not a big volume of medicine. That's something the public is not aware of.
That's right.
Mr. Dykes, do you see ever antibiotic residues in honey?
There have been reports of that, yes.
Okay. How many reports and what volume and who's taking them? And I'm collecting information.
Sure.
I'll tell you why in a minute.
In the United States, a majority of the honey producers do not check for that type of thing. Overseas, so if they're exporting the honey, it's very much looked at. And so I know honey going into Germany has been scrutinized very heavily by the German government for antibiotics, and I know that
German.
What's that? Had to be German. But I know that they have had issues in the past with that.
Like issues being
Issues being detection.
issues. Lots of reports.
Many
high levels.
many
Are
reports.
there action or tolerances in Germany?
I'm not actually familiar with what their tolerances are. From my understanding, they want as little residue as possible.
Okay.
And as I think we heard from one of
Point
the
in time, I'll have to come talk to you and the
Sure.
Copper guys to figure this out.
yeah. But I will say, though, from a public perspective, that's been an issue that the beekeepers have always worried about is if it is tested in the United States and found to contain antibiotics, the public perception, with chicken and all this stuff, everything's going, antibiotic free. If they were to find it in the honey supplies, that could be a big issue for the industry. And so they're very much cognizant of that. That being said, in the past, being an over-the-counter prescription, people could kind of do what they wanted with it. So, that is why a majority of the large producers did not object heavily to it, because they don't want that scrutiny to be put on the industry.
So you're probably a tiny, tiny amount of the drug use in America.
As far as that goes, yes.
Yeah.
Very small.
That's a key that I'll get to in a second. Dr. Gordon, how's it going in small ruminants? Got a lot of what you wanted out of that CPG.
Yeah, I think the sheep and goat industries did get a lot of what they wanted, and from my standpoint, it's going fine. There's certainly been a lot of expression of disgruntlement among producers, but when the rubber meets the road, it's really hasn't been that big of a deal for us. we've actually done very few in our practice. We've done a few for sheep and goats, and this time of the year it's all been abortion related. Now as we move on through the spring and get into the summer, I suppose we'll start seeing some growing sheep requests for VFDs, but my estimation so far is that everyone is adjusting, and while and it served as something to complain about mostly, but so far I haven't received any visits, so I assume we're either just getting a lot of benevolence from the FDA inspectors, or we're doing it okay, and so it's working. The other thing I think will happen, and no doubt this was part of the plan all along, is that it's caused a lot of producers to step back and look at it and say, do I really need this now? And that's a good thing. That's a really good thing, because we've been able to say, maybe not. Let's look at other alternatives, whether that's vaccination or herd health plans and flock health plans, things like that.
So under the CPG, are you seeing a lot of use of other species drugs?
No, not yet. No.
Okay. Do you think that's going to happen?
I think as we move along through time, we'll see more cattle use, especially in sheep and goats, but rather than just what's already approved. But
when I spoke last year at the sheep conference, they screamed and yelled at me, "It wasn't my fault. We had to do this. We were told something was going to happen." So here's the deal, and we're looking for a home for this. The feed industry is willing to forego its limitation of extra-label drug use in Amduca. We have a golden opportunity to make this happen in this administration. In other words, to strike that provision so that extra-label drug use would be allowed in medicated feed under some circumstances that the agency defines. What we haven't worked out yet is whether we want it to just be to VFD or we want it to be to any other drug. Our problem with any other drug is we don't have control of it, and our companies, being very large multinationals with brand names that you know in the marketplace, want a piece of paper from a veterinarian that absolves them of any liability for the most part. It says you all are allowing us both regulatory liability and any product liability or animal liability. And the reason we can get there is VFD's been made the way with all of these other drugs. And now that it is, there's really no purpose for extra-label drug use because it's not prescription medicated feed. We have run into another problem with water-soluble products that went script. Pharmacists need to be in feed mills and retail dealers to dispense those in Wisconsin and Minnesota, and that's going to spread. That was a mistake. We didn't see this coming. We're even looking at calling it Veterinary Feed and Water Directive so that those water products can move back under the control of a veterinarian without the state pharmacy boards, which is an unintended consequence of all this. My members, we represent 75% of the 183 million tons manufactured, and they've been screaming bloody murder about this changeover for months and months and months. Primarily because their VPs for marketing and the commercial side could not figure out what they were going to make. They didn't know what the use patterns were. They didn't know what the drugs looked like. It took a long time for the drug sponsors to get all of these products to the feed guide so that they could change their. One company told me they had 58,000 labels to change. And that's no small endeavor when you look at the number of feed labels, millions of feed labels in medicated feed. So that notwithstanding, we seem to have gotten through that. We really like to have a serious discussion about Amduca and VFD. And we're looking for a home to have that discussion. If you all would like to take this on and bring all of the producer groups in to discuss it. In my 25 years at AFI, the largest coalition we ever had was VFD. The state pharmacy boards were involved, the state vet boards were involved, and we did it because we had to do it. Nobody liked it. It was the future of all the drugs that came out. But now it has become a nightmare. We have a meeting in the morning with a congressman from Oregon who's a veterinarian. He is very interested in what we have to say, and he sits on the FDA Oversight Committee in the House. And we're glad he's asking us what we think. And so that starts us to have an opportunity to amend Amduca and strike that provision. And in this administration, who really don't care about activist groups, I think we could probably more likely get that done. especially that there's not a filibuster allowed in general legislation. Does that make sense to people here? Tommy, you love it. Right now we've only talked to AVMA and the swine people.
Susan, do you have a comment?
Okay, I'm a human pharmacist, but I've worked at Auburn University for 40 years as a veterinary pharmacist. We have an organization called the Society of Veterinary Hospital Pharmacists. There's only 60 members who are only pharmacists that work at veterinary colleges. You need to meet with the national board. We would be glad to send some people to talk to you because I cannot educate pharmacists fast enough to handle companion animals. We have taught them not to endeavor into the food animal realm, and they aren't educated to do that. So there is no way that a pharmacist should be involved with this at all. So that is, and the only problem I have with the extra label use in the minor species is, and I've looked at withdrawals over many years, you have cattle and they look fine, but their serum creatinine's 3. It's not 1. People don't look at serum creatinines, and if you take this 10-day deferral and you use that extra label at a higher dose, somebody, a veterinarian has got to figure out, first of all, how that's going to change because a sheep is not a goat, and how that deferral is going to change. And so there's got to be some guidelines for safety, or we're going to have a lot of contaminated animals going to slaughter if we don't look at this in great detail. But, you know, you need to talk, I mentioned this last year, but you need to talk to the National Board of Pharmacy because they
were part of the VFD.
Yeah, they're very logical people, but our group will be happy to talk to whomever because, you know, I know what pharmacists call and ask me, and it's really scary. They don't need to be expensive. For food animal, with the exception, a lot of pharmacists are on farms and they understand, but I don't know how that happened in those 2 states, but in our state, our board called and said they just want to make sure that we agree they don't need any part of that. We said, no, you don't.
But this is for the water side that are strict.
It doesn't.
They didn't want to do that.
No.
Okay, these 2 states exerted their authority under their pharmacy board.
We can't even keep the Loratab and the ketamine and all in check, so our board of pharmacy does not want to
That's nice to know.
go into that arena.
Yes, sir.
I don't know what you're hearing overall, but I've had to talk to congressional staffers more than once, where producers call their congressman to complain they can't get their preventive drugs for the spring scour season. And it's individual basis, but tracing it back and figuring it out, there's a lot of veterinarians, older veterinarians usually, that refuse to do anything with the VFD with the producer. I found out several occasions where the producer wouldn't pay the vet anyway, so wasn't going to make a farm visit for him. So his excuse was they were going to pull his accreditation and his license if he helped him out. So he just refused to do so. But it's, you know, you hear across the U.S. where we got a shortage of large animal veterinarians. We got a shortage of paid large animal veterinarians who aren't servicing that sector because they're not getting paid to do it. And I think that's one of the things I've been hearing more than anything. It's not really the VFD. It's the guys who are out there supposed to pick it up and take it and aren't. And then for Mr. Dykes, we went around in Utah, which is the beehive state, which has very little to do with bees and a lot to do with industry. But we went around and we stood up 5 different meetings regionally, and at those meetings we invited veterinarians and producers, but we talked about brucellosis, trichomoniasis, VFD, and we took with us a bee guy. And the bee guy brought his beehive, and we have an apiary program in Utah Department of Ag, so he brought that with him. He was the last one to speak, and the veterinarians just came up and flocked around him and were just super attentive when they heard that these guys were carrying these hives out to California at the rate of about $2 million each time they took them to the walnut groves. They were very interested in becoming bee veterinarians. And actually, we had 27 veterinarians sign up to be bee veterinarians for them in the state. So it was a very, very healthy thing that we did to do that. And they're super interested in all that goes on, and mostly American foulbrood and Thailand cake is what they were talking about. But still, it's working so far.
Good.
Follow up on this, the AVMA has developed some bee resources to help educate veterinarians. We have a 60-page document basically going through the basics of beekeeping. We have 3 webinars plus a 4th in the works that are going through the process to get AVMA CE approval. And additionally, we have four lectures as well as a wet lab scheduled for our convention this coming summer.
Good.
Because there is a lot of demand by veterinarians to learn about bees in a hurry.
Well, let us know if we can help.
Closing comments from our panel. We can start with you, Eric. What do you see your industry adapting in maybe a year, 5 years, or what biggest hurdle, anything you want to close up with?
Well, probably the biggest hurdle or the biggest thing we need to do, and this is, you're not going to hear me say anything new, and that is we need to continue to push for labeled products in small ruminants. We do, and I understand the reason that the manufacturers and pharmaceuticals don't, but there is some stuff happening, I think, at the FDA level with goats, and especially, but it's a long time coming, but that's the best thing I think we can do, is we can still push for more labeled products that are effective at the labeled dose that we're at, a dose that we need to use them to handle the things we have. That's going to be really hard to do. It's sheep and goats are such a small part of the industry and such a small portion of antibiotic use as it is. I think the last sheep NOM study was 2011, I believe, and that reported something like 12% of the sheep operations in the U.S. even use antibiotics. So it's a small portion of the industry, but it's really great that we have this CPG 615 now. It gives us some latitude. It allows us to handle issues. It's a little bit cumbersome at first, but I think the producers are adjusting to it. The veterinarians will over time. We'll be fine, but I'd love to see more things be clear cut with that part of the industry, and that's going to take some time.
Yeah, we're like Dr. Gordon's industry, the small ruminants, is that we do need more drugs. We have a nice meeting that's held once a year. It's the Aquatic Animal Drug Approval Workshop put on by the U.S. Fish and Wildlife Association. So there are a number of sponsors and research who attend this meeting, and we're moving forward with our needs in the industry. So it's a very, very good group that comes together with sponsors, researchers, and regulators. And so we're making slow progress, but we're making some progress. So that's a very good thing. I'll just make one comment about the antibiotics, the immersion antibiotics. One's labeled as a marking agent, oxytetracycline hydrochloride, that binds to skeletal tissue. And I was unaware of the extent to which I think some producers are actually using this as preventative antibiotics up until this year, when they came to me to ask me for prescription drugs. I was a little disappointed, but anyway, I think that's something that needs to be looked at as far as the use of it. If we're going to be serious about judicious use of antimicrobials, I think that we need to take a good hard look at that particular use of these antimicrobials.
Mark? Contrary to what, or different than the other industries, we got enough drugs. We don't need any more drugs. But the issue that we're having is we have an industry that has never had contact with vets, never developed those relationships. And so for us, the biggest hurdle right now is getting those relationships in place, getting those protocols. And I think we're moving very quickly towards that, which is great. But we have so many other problems in our industry right now. The antibiotics are really not on everybody's mind, which is good. But at the same time, when they are needed, they do serve a very, very good function to help suppress disease in the industry. So it's kind of a mixed bag with us, but I think we're moving in the right direction. So
Great. Well, let's give our panel a round of applause.